In today's episode, learn what the Birth Healing Intensive is really all about as I talk with the students from the 2025 Birth Healing Intensive at their live gathering. Listen in to hear how the work from this program changed not just their practice, but their entire way of showing up in the world. They share what happens when you stop trying to figure it all out and start trusting your hands, your heart, and the body's wisdom. From emotional breakthroughs to spiritual grounding, they uncover the hidden layers of healing most clinicians are never taught. The conversation explores how true transformation happens when you're willing to do your own inner work. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody, and welcome to the Birth Healing Summit podcast. And today I have a special treat for you. We have students from the 2025 Birth Healing Intensive cohort with us here, and they are going to share some wisdom that they've learned from this program that they feel might be helpful for you. So we're going to start over here with Crystal. Go ahead and introduce yourself.
Hi, I'm Crystal Nakata. I'm from Tucson, Arizona. I work at El Rio Health, a community health center in town. I'm a pelvic health physical therapist. My main goal and what I've really learned from the intensive this year is really how to trust myself, both as a clinician and just in my life in general. And so I feel like this course really melds that together of how to be the best version of you so that you can show up to be the best clinician for your clients.
Awesome. Thank you. Hey.
Hi, I'm Katie Newhouse. I'm a pelvic health physical therapist practicing out of Long Beach Memorial Medical Center in California. And for me, Lynn, I just want to say thank you. This course was such a gift.
Thank you.
And I think this course for me was about learning how to ground and fill each day before starting my practice and also connect in with the divine or that higher power. That's been huge. Just that little prayer at the start of my day and feeling that groundedness and connection then throughout the day. Also, I feel like in this course, if you choose to go through it, you're going to learn that it's a lot of work on yourself. So the things I realized, these are things that I was being triggered on. And then I was able to do that work with this beautiful group of people and work through those to where they're no longer being triggered.
Yeah.
So that was such a gift. And then one more, sorry, take everything. Not having to have all the answers, not needing the plan when you start your session, and just trusting the body, the client's body and your intuition. And that's going to guide the session.
Yeah, that's huge, isn't it?
So
Yeah, I love it. I don't like having to figure it all out. It puts a lot of pressure on us, but that's what we're taught in our school and in the medical system is we know it all. We have it all figured out. And yeah, we don't. Even if we say we do. Fire.
Hello. Hi, so my name is Fire Alexander. I've been practicing pelvic health specialty since 2001. And I am just so blessed to be in the company of such amazing clinicians. And if you've thought about this course, if you've considered it, if you've never considered it, you're seeing this for the first time, just do it. Your life will be only better for coming and meeting every month, finding a study buddy, lots of different study buddies, lots of exposure for different faiths and beliefs, and just being able to embrace all of us as we are helps us to be able to be that much more for the people that we are trying and succeeding to help them on their journey. Lynn likes to say, we're not here to fix them, and then that's absolute truth. We're just an avenue. We're just a vessel we're just a guide, and being able to um, learn and explore and take that adventure with such amazing people, such amazing women from
Yeah.
all over the country, all over the world is just fabulous. And I just wanted to say thanks, and thanks for my faith, and thanks for allowing me to have this time in my life. Even with 25 years experience, I still learn from each and every one of everybody that I've met.
Yeah.
Hands on and hands off.
Oh, well, and y'all need to thank yourself
Right.
for saying yes to yourself,
To yourself.
right? Yeah, because
Being brave just to be here.
yeah,
And
exactly. Because
open up.
yep,
Mhm.
good job. Thank you, Fire. Yeah, Lisa.
Hello, I
Hi.
am Lisa.
Mm.
My name is Lisa Dempsey, and I am an integrative physiotherapist, and I am from Queensland in Australia. And I feel so grateful to be here and to be in America right now. I'm saying that true, feel like I'm in a movie. And also to have taken Lynn's course. And my intention beginning the course was I didn't quite gel with the traditional world of physio, and I felt like there was something pulling me towards something else, and I didn't really quite know what. And I guess it's a feeling. And that is so beautifully carried through the work that Lynn does. Sometimes it's actually really hard to put it into words, and it's a feeling. So sometimes we don't need to have words. It's a felt experience. And so, yeah, I just followed that nudge. That was my intuition. And I was then able to strengthen that through the teachings and the learnings. And as that has grown and developed, I've become, so much more in tune intuitively that I'm then able to feed and use that into my work with the clients. So that's been one of the biggest blessings. And as an integrative physio, it's like this connection between mind, body, and soul, spirit. So it is this beautiful blend of allowing me to bring that into the clinic. The other thing that I really loved is just this connection between everything. And I think we can sometimes feel quite disconnected, or that things are so separate from one another. And that's why I love that term integrative, is that everything is connected. And it's like the breath, the nervous system, the like energy, sound, muscle, fascia, it's all connected. And it's beautiful. So thank you.
Yeah, you're welcome. Thank you. Miss Lisa, another Lisa.
My name is Lisa Webb. I'm come from a slightly different background than most other people. I'm a OB/GYN physician. And I've studied integrative medicine. So I agree that the integrative piece is huge. And I've known for a long time that a lot of pelvic pain and things that I see in my patients has deeper than just the physical roots, but I didn't necessarily have anything to do for it. And now Lynn has given me some techniques that I can do myself or refer on when it's too much in my appointments.
For 15 minutes that you have.
But I'm very grateful to have even just a few techniques to be able to use on a regular basis. And the support of the group has been huge. And for, self-healing, it's great. So thank you.
Yeah, thank you, Lisa. Miss Heather.
I'm Heather LaFerrier from Portland, Maine. If you're looking for something to transform yourself and your practice, this is it. You can't take this course with Lynn and not change. And so if you're open to that and you're looking for something else for your own healing and for your practice and for your clients, just jump in and trust. Trust this process. That's one of the things I've gained from this the most, is that these things that we think through and we make so hard don't have to be. Just allow it to unfold and trust the process and have fun with it.
Yeah. Yeah. It is a lot more fun way of working with the body, isn't it? Yeah. Yeah. Love it. Danielle.
I'm Danielle Hughes, and I'm a craniosacral therapist in Evergreen, Colorado. And I don't even know where to begin with this work. I actually got into craniosacral therapy largely because of the pathway that Lynn opened through my own work with her as a patient. And she was my first connection that there was more than just the physicality, kind of as Lisa just mentioned. There is just it opened up to the connection with emotion and spirit and so much more that was within me that I always felt and just kind of kept getting denied through traditional medical practices that I was seeking after postpartum and needing some deep support. And so that began my journey with craniosacral therapy and just feeling into the body, and doing the birth healing intensive just sort of solidified, I think, all of the things that a lot of us feel but don't say, because we're sort of taught not to. We need to know, we need to keep in our head, we need to have the answers. And being able to tap into something deeper and greater and feel and trust that, and just see, it's like I just get the picture of this cocoon and these butterflies all emerging on all of our tables as we work on everybody, because they're able to connect and fully, everything's integrated. We're not blocking these pieces and trying to keep them all down. It's like, it's okay, safe. And there's so much freedom in that. The amount of growth personally through this process, and just how intentional it's designed, like it just keeps building slowly, so you're able to integrate and take it in without it being overwhelming. And then you go back at the end and you see all the progress that you've made. It's extremely powerful, and just pure love, I guess is what we can say.
Yeah, absolutely. I love what you and Lisa were talking about, in that we're taught how to work with just muscles or just bones or joints, and or fascia. And it really is, Lisa, you said this earlier, that it's about working with it all together and not trying to keep things separate. And, we're really making effective change on the entire system when we put our hands on a body. And we don't need to compartmentalize our treatment approach. And we can listen in with our hands and decide what needs the attention. And it's more simple, right? We don't have to figure it all out. And yeah, it's so fun. So thank you for sharing that, you guys. And then we have Landy here. Landy actually helps me teach the course. She's a lab assistant and helps out with the group calls and everything. So thank you, Landy, for all your love and support in the program. What do you have to say?
So I originally took this 6 or 7 or 8, my son's 8, so almost 8 years ago.
Wow.
And the original work literally changed my life. It was the missing link as a clinician, where a lot of us come to, there's something there, and physically we're not shifting it, we're not moving it, it's not making changes, we're doing everything right. And then came in this piece, and it's like, oh, it's because there's more trapped in the tissues, there's more story, there's bringing in the emotional, social impacts, not just what's going on physically. And I literally brought this into my work, and my practice boomed, and my own self-healing came in. And then, of course, I've stayed with Lynn forever. So I love this work, and I see the changes every day, and I've brought it into so many different ways into my practice, in both pelvic health practice and coaching and working with perimenopause women. It's not just peg hold into working prenatal postpartum, it is working with humans.
Well said. all of you. Wow, that is so amazing. Is there any last piece of wisdom or advice that you want to give the audience that are listening in? Anybody before we say goodbye?
I would listen. Oh, you guys listen to your body. Yeah.
Okay, for what?
The answer.
Oh, okay. So the body lies within, or the answer lies within the body, not the head, right?
Yeah.
Correct.
I love Suzanne Skurlock, who she comes in as a guest speaker during the course, and we have to read one of her books for this program. And she talks about it's not about getting out of your head and into your hands. It's about blending, bringing the head, the heart, and your hands together. And that's truly what this work does, is helps you to bring all three of those into your session, so that you're not just guided. You don't have to figure it out, like Katie was saying there, right? What were you going to say,
That's
Lisa?
the piece I was going to touch on, is like we get to use our bodies and lead from the heart as well to help
our clients get into their bodies, because that's where so much of this lies.
Yeah.
And I think also in the power of the collective, like just our cohort that we had, it's kind of amazing, even though a large amount of this work is done either virtually or just on our own with study buddies. Just the power of these relationships and the sharing and the teaching that we've all brought together has completely up leveled my own personal, practice and connection. So I'm thankful for all of the teachers.
Yeah, and I actually reached out to some students from last year's cohort, the 2024 cohort. And one thing that someone said, which I absolutely loved, and I know will definitely be true for this group as well, is that you all have, in this cohort, 18 people that you could reach out to if you had any trouble with anything at any point in time, to reach out and say, hey, I need support. Can you help me? And it's like, we don't need to pay for therapists, because we've got each other to support each other. And I thought that's pretty darn cool to be able to know people that you can call and reach out to if anything's coming up for you that we're not able to deal with on our own. And you are given the skills, the skills that are taught in this course are meant for you to work on yourself. And there are things that we can't always do on our own. We need that support of just a witness sometimes, of someone just to be there to hold space for us, so that we can actually access a deeper layer within us that we might not be able to access on our own. And to be able to have people you can call on to reach out and have that support, I think that's priceless.
And I think that 2024 cohort now has a new addition of 18 to add to their list, because we all speak kind of the same new language.
Right.
Yeah, so cool. Well, thank you all so much. I am eternally grateful to all of you for stepping up, saying yes to yourself, saying yes to your to this program, and for doing the work. It's been amazing to witness and see all the growth and expansion in each and every one of you. So I'm so grateful. And like these guys said, if any of you are thinking about it or on the fence about joining the program, please just fill out the application. That's the first step. And we'll get on a call, you and I, and we'll see if the program's the right fit for you. And the registration is open for next year, and we would love to, if you're interested, just get on a call and see if you want to join us or not. Okay? All right. Thank you, everybody, so much. Thank you for listening in, everybody, and we will see you all on the next episode. Take care, everybody. Here is to smoother births, faster recoveries, and doing your own work so you can show up more powerfully for your clients. Take care, everybody. Bye-bye. Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.